Very good evening. This is your friend Dr Suresh Shenvi here, and again today I have one of my friend, colleague, a student from KLE Institute of Dental Sciences who finished her undergraduation in 2014, and Dr Arjita is here. Glad to have you on Aspire 32, Dr Arjita, and I'm hoping to get a lot of information about this new course which you have recently done from UK. And please, give us some information. And first of all, my dear audience, she has been practicing in Mumbai in various clinics, and she's into aesthetic dentistry as a specialty.
Thank you so much for having me, Doctor. And it's a pleasure being here. I must say, I have been seeing all the content you're sharing on YouTube, and it's really commendable what you're doing. When I started searching for something in aesthetic dentistry, it was really difficult. So I know you're providing a great platform to all the dentists who are looking for various options after BDS. And that is such a great thing. So hats off to you.
Tell me more about the aesthetic dentistry which you did from King's College of London in 2019 to 2021. I'm sure it was exciting, but let me ask you, very simple question: that when it occurred to you that I should be doing like this? What was that moment when you decided that I will do this?
So it gradually happened because when I was in the final year and during internship, I was really drawn towards aesthetics. Like composite was my favorite material. And once I started working, I was associated with the practice, which did a lot of aesthetic restorative procedures. So I was exposed to a lot of those smile designing with different materials and everything from very early on. And as I started exploring articles and papers on the new aesthetic advances, the latest developments, I realized that aesthetic is actually a combination of many restorative practices. So that had perio element, it had a prostho element, it had a conservative element. And I really wanted to get that comprehensive knowledge and skills to handle those cases on a daily basis. And I started looking for courses, and I still remember I had Googled the best comprehensive aesthetic dentistry course in the world because I wanted to be the best in it. But once I did that, I came across the course given by King's, and it was exactly what I was looking for because I didn't want to leave my practice in Mumbai and at the same time gain the knowledge and skills pertaining to aesthetic dentistry. So it was a blended program, and that really meted all my needs. So that's how I ended up doing the course.
So you decided to Google about this course, and you came across that this is the best course you should plan. And you did this after how many years after internship, or it was during your internship you decided about it?
No, I took my time actually because I was very clear I wanted to practice general dentistry for a few years and see what was really my interest, because I had a lot of interests. I liked pediatric dentistry, I liked conservative dentistry. So there was some confusion, but there was love for general dentistry. So I thought, why not try practicing for a few years? And after a few years, I realized what I really like is aesthetic dentistry. It took me some time to realize that there is something like aesthetic dentistry that is basically the restorative processes. I enjoy doing it, and I enjoy making that change in the smile of the patient, the reaction of the patient. That was really something very intriguing for me. So once I realized that this is what I like doing, I started searching how to really be the best in that or how to give that to my patients. And luckily, I had that platform where the patients wanted me to provide them that.
What was your initial experience, and who guided you to find more information about this course, and what exactly is this course named as?
So initially, when I saw the course, there were a lot of colleges providing this course. So I went through the different curriculum of the different colleges. The reason for choosing this college was because it was over 3 years. It had a research element, which I was looking for because I was really interested even in the clinical research aspect of it. And it was having an evaluation point also in the course. And it was over 3 years. It was a blended learning format, which was not provided by all the courses, actually. So I was quite sure I wanted to do this course. But once I went on the site, the application process is actually quite straightforward. Once you see how the application process is, you can easily apply for it. But my dilemma was I wanted to know whether I'll be really able to apply whatever I learned during the course in my practice. So luckily, I don't know, just after I saw the course on the website, just 2 or 3 days after that, I came across one of my colleagues from KLE who was actually doing the course. She was in her first year of the course. So I guess the entire universe was actually directing me towards what I was passionate about. She luckily was doing the first year, so I got in contact with her, asked her how the course is and how would I manage my practice and the study together. And she guided me a lot on how the course is going to be about. And through her, I even got in contact with the Indian student who was taking the course. So I think more than applying, I think I was more intrigued about what is the course content and how useful would it be in my practice. So that is something I reached the alumni for, and I asked my doubts. And once I was sure about that, the application process is quite straightforward. Once you go to the site, it's quite easy to understand.
What is this course named exactly?
So the course exactly is basically covering all the restorative aspects of dentistry. So it has a prosthodontic component, it has the conservative dentistry component, it has even a little of perio, of orthodontics, of facial aesthetics, and even implant restoratives. So they don't teach you implants, but they teach you how to do the restorative procedure after placement of implants. So it covers every aspect of restoration, and it puts an emphasis on how to keep the functional stability, how to get predictable results, long-lasting results, and it's all evidence-based dentistry. So that's what mainly the course is about.
Of course, when you decided, I'm sure there would be some specific requirements by the university, like maybe you need to have the certificates. What were the minimum requirements if you want to be a part of it?
Yeah, so the main thing was they had an online application form through which you had to give your SOP, the statement of purpose, your transcripts, IELTS is a mandatory exam which you have to give. And
my dear friends, if you're not aware about the SOP, we have already made a podcast about the SOP on Aspire 32. Do check it out and you will understand it better. So Dr. Arjita, so you decided, okay, I will go ahead with it and these documents are there. So these documents are submitted online or you have to send them the copies of it?
So yeah, you have to send it online. Everything is online there. So sorry, I missed the letters of recommendation too. So you have to send all this online actually. The IELTS exam which is there, that you need a minimum of 6.5 overall and 6 in the others, that is reading, writing, listening and speaking. But I would say to better go for a 7 overall and 6.5 in the other compartments. And everything else, yeah, is online.
And how did you prepare for this English exam? Did you take a coaching or you prepared on your own?
So initially I had thought that I'll take coaching, but then I started searching for IELTS online. And once I saw the videos and everything of how IELTS is attempted, I thought maybe I could do this. So I can guide people who really want to do IELTS. It's not that tough. So I had gone for a few sites like IELTS.org or BritishCouncil.org. They have this PDF-based IELTS examinations, which you can attempt, like write down your answers and then check the answers at the end of it. There is another site which is called Magoosh.com. In that you have one PDF format, but all the tips and tricks of how to go for the different components of IELTS and what do the components consist of have been very well explained in it. There's also a UI-based app, which is known as IELTS online tests. In that, you will get a lot of papers which you can attempt before your IELTS examination. And in that, basically, it's UI based. So what happens is a time is given for that, and you can attempt all the questions, and at the end, you'll get the answers. So it's a great practice platform for whoever wants to attempt the IELTS.
Yeah, I think it is more about practice, all this English exams.
Yes, you have to practice. Yes,
the more and more you practice, more and more you solve it. Sometimes you appear for once, then you realize maybe this is how you should be preparing, and then the next attempt actually turns out to be good. So you submitted the application, and how many days do they take to reply or to complete your application process?
So I would say to apply as soon as possible. The applications start around April, but I was quite late. Like I had applied around July, but luckily I got through in the first attempt. They give you an answer within 6 weeks, and either it's an unconditional offer or it can even be a conditional offer where you have some requirements to be met, or you can even be called for an interview. And after you clear the interview, you might get through, or you might also be on the waiting list. And they might give you a yes or no after that.
Okay, and how many students do they enroll per semester or per year? It happens once in a year, or it's a semester system?
No, it happens once a year. So the maximum they take is around 24 to 25, not more than that. And it's from all over the world. So the students are from all over the world. Sometimes the class is even less because they believe the quality is more important rather than the quantity. So if you are really meeting their requirements, then they will take you. Otherwise, it's, yeah. So you have to really meet the requirements to get through.
And what do you think are important aspects which one should be working on if they want to get into this aesthetic dentistry course in King's College?
So basically, they are looking at your SOP where you get the chance to explain them why are you so passionate about this, and that is where you have to give them a guarantee. Yeah, either you're having your own practice or you're associated with the practice where you have this kind of possibility to practice this domain, where you will be able to give that patient care, where your patients are gonna be giving you consent and time to do these procedures. Where you are passionate to do these procedures, learn about them, because there are so many aspects in this. It's not like it's only one particular portion. And if you will be able to do the perio part, the prostho part in the clinic where you're working at, and whether you have the lab access to do this, whether you have the time to do this, whether your staff is fine with you doing this. So even the letters of recommendation in a way make a huge impact actually.
Yeah. That's actually nice, because people who are really interested in doing that would be applying it. Nobody's forced to do something which they don't want to do.
Yes.
Of course, once you apply, once you get admission, I'm sure there will be a visa requirement also. I'm not much aware about visa about UK. Can you throw some light on this aspect?
So once you get the offer, you'll get an unconditional offer that can be used to apply for your visa. So either you can apply for a short-term study visa, or you can even apply for a visitor visa, because for the practical classes, you only go for a few days there, almost like 2 weeks, not more than that. So you can either apply the visitor visa or the short-term study visa.
So as per your information, this is on, I don't know how, it is a combined, like you have to prepare in your country, maybe study in your country, then you go for some classes there. So how exactly this is divided? How is the curriculum planned in this?
Yeah, so I'll try to explain that, because it's quite difficult to actually put it in words. But so basically what happens is all your lectures are taken online, and you have all the study content and everything provided on a platform online. All the clinicians and tutors from all around the world give you actually lectures and everything there. So a particular time is put for your lectures. And luckily, since we are from India, so they have their classes in the morning. So it's like 10 or 11. So it's in the afternoon for us. So for Indians, there is no problem, because for some countries, I think it might be quite difficult to attend the lectures. But even if you do not attend the lectures, they are recorded and you can always go back to them. So that's how the lecture part is done. Other than the lectures, the clinical part which is there. So you go to London there, and there's a place called Lundek as the Waterloo campus there, where you have all the world-class facilities and everything is provided by them, the materials and everything else. And you have all clinical practice during those 2 weeks when you're doing the practical session there. So all the clinical knowledge is imparted on you during that time. And once whatever you learn, which is usually in the beginning of the year, every year, and whatever you learn, you come back and you apply that here. So it's done a little at a time. So what happens is whatever you learn, you can come and implement it during the remaining months. And you're actually even getting simultaneously evaluated for that. Other than that, even there are clinical procedures which are shown online actually. So even that happens. Even there are case discussions. So supposingly you have some confusion with the case, or the professor wants to discuss a case with you, then we have a tutorial again for that, and we discuss that case. So it's like this, the blended kind of format in that. And also there's an evaluation process also, just like any other master's program. So you have assignments, you have an exam at the end of the year, you even record the clinical cases. So all that is done during the course.
I think it's well planned, and I'm sure everything was accounted for. And when of course, all foreign universities make sure that the curriculum is well adhered. So that was theory, more about theory. And I want to know a few things, like when you went there, what exactly, like maybe you can tell us your experience of the practical classes which was conducted there, and how was the experience? How different was it? And maybe you were already doing clinical practice. So
Yes.
when you went there, what difference did you see in the practical classes compared to what we are already doing?
So I will say when you're going for this course, it's actually quite advanced. So a little knowledge before going for this course is really required. I mean, you need to have a base of clinical experience before you really go for the course. Because even though we are not doing directly on patients, because obviously you need a license to actually do them on patients there. You are doing them on typhodonts, but it's on models completely, like a proper dummy and everything is there. And you have access to all the kinds of materials. So when I'm saying even for a particular composite skill which is taught to us, the different techniques which you can use, like injection molding, or even in the class for what are the different materials which are available in the market, you will get access to each and every material which is available in the market. There's nothing which they are not going to provide to you. They're going to teach you all the techniques. It's not like only style Italiano or only DSD. It's not like a particular thing. They're going to really give you the exposure to every procedure which is available in the market, which is up to date in the market. So you get access to a lot of things, and whatever is the latest, whether it be scanning, whether it be anything, they have a lot of facilities there. It's really a different kind of class practice altogether. So you get a lot of exposure.
And what difference did you see in the teachers of India and teachers of, I'm sure online, I don't know, it's difficult to judge a teacher, but suppose you were interacting with them there. How different was it compared to teachers in India?
Honestly saying, teachers everywhere are good. It's not, luckily I have been a student of KLE. I don't know about any other universities, but I know I was very comfortable with all the teachers, even in KLE. And even here, there, of course, the only thing I will say is, you have much more staff, you have more access to more staff, because there are a lot of specialities they are teaching. So anyone who is a top notch in that particular specialty is going to teach you that particular aspect. So you meet all these world renowned people who you have only seen and only heard of, and you get to meet them. So that is something very exciting. And there are people coming from USA, people coming from Australia. So that's an exciting part of it. Otherwise, teaching ways are, of course, more clinical based, because obviously we are doing blended learning. So you cannot waste time giving again the lectures, right? So it's more clinic oriented. That's the only thing. Otherwise, as such, I feel teachers are the same everywhere.
And of course, the one thing which everybody wants to know in any course which we recommend is what is the overall expenditure, which one has to bear for this aesthetic course, what you have done in the UK.
So overall, over all the 3 years, it's around 34 lakhs, all the 3 years. And it involves even the application fee and everything which you give. Everything comes up to 34 lakhs.
Was it your first time visit to UK, or you had already been to UK or any other country?
No, I have been lucky to actually go on. I have been lucky to go on a tourist trip to UK before that, and I think that was another reason why I thought I'll be comfortable, because there were a lot of countries which I had gone through and everything while looking for courses, but I was comfortable choosing this. And of course, also the ranking of the college made a big difference, because it's one of the best colleges, one of the top 10 colleges in the world. So yeah, that made a lot of difference.
So that means no student has to really worry about that. I'm sure UK, there are many Indian students. So it won't feel a difference, like it's different for the students there, right?
Not really.
Did you have Indian students in your circle? Like, how many Indian students were there?
There was only one more.
Okay.
There was only one more.
And from which other places you had these students?
So there were people from US, there were people from Canada, France, Greece, many Australians actually, even from Britain actually, London, and even the other European countries nearby. A lot of them actually from. It's really like it was a very unique batch, and I really liked that about the course. I mean, I got exposure to this global exposure, you can say, because all these people are practicing in different parts of the world. What kind of practice they do, how different it is from what we are doing, and you start seeing you have a lot of advantages in your country.
Yeah, what was that advantage? Because everyone tells about disadvantages of mostly the India. I don't think that way, because I have visited a few countries and I feel there are good things in our country.
Yes.
What was the positive and negative things which you would like to highlight?
I think it's the way you look at it. Honestly speaking, I feel in India that you don't have the tension of the litigation part. I mean, you do, of course, there's some part of it until and unless it's like a very big, massive problem. I don't think it really comes into light. But in UK, it's a big thing. Like they are very careful about consent and everything, which even I took a lot of care while doing the course actually. And in many of the parts of the world, especially when it comes to aesthetic dentistry, it can be very tricky in the other parts of the world actually. So that was one big thing. And I felt that the patients here are much more, I don't know, I feel like the patients here will give you your time as long as they know you and they know how you work. Once they're convinced with how you work and they're comfortable with you, they're going to give you your time. And even if you want to try something new, which I did a lot because I was suddenly using rubber dam, DSLR and loops, which was completely new to my patients. But they were very adaptable and they like it actually. They were very like, wow, you're doing a course from abroad and yeah, we would definitely like to do this. And it was great actually. So I realized, there are such big positive points actually here, which I really like in the practice. And that's what I wanted to do, like get that aesthetic practice here in India, because I feel that's really upcoming here and people are really looking for it. And with the internet, with the power of internet, they find out the procedures and they're looking for the treatment. So, I think those are really big positive points here.
I think, loops, few things which should be really made compulsory at undergraduate level. I don't know, even I took some time to move to loops, but somehow the colleges, you cannot ask a person who has not used loop to tell you about loops, because first of all, most of the time the loops when you buy, it is highly demotivating because suddenly you feel that your instrument is not coming in your area, right? So it has been my mission in last 1 year that I want to move students towards.
So that was one difficult point for me actually, because everyone abroad was so used to doing loops and everything, and it was I took some time. I'll be honest, it was very challenging. I don't know for the other Indian dentists, but for challenging for me to get so much new into the practice. Using a rubber dam, I mean, I'm sure everyone doesn't do it for all the procedures, maybe for some procedures, but not for all the procedures. So
I think it all takes time. You have to give time to the patient.
But it definitely changes your practice. It definitely changes.
Absolutely, there is no doubt to it. There is no doubt. We have people who have done it.
Your posture is better. Your work is better.
Yes. Absolutely. I think that is something which the people who are listening should take home as a message and try to incorporate it in their daily practice as a student or as a practitioner. So one last question, because you have answered almost everything, and I'm sure the viewers will ask me some questions in the comments if they want to know more. The last question which everybody wants to know is, if you do this degree, by any chance, are you allowed to practice in the UK as a dentist? Because I'm sure it may not give you, but is there any possibility or something like this?
So no, if you want to practice in UK, you have to give the license exam. There is no other way. But then, of course, if you do this, you know the way the practice is in UK. So I think the practical aspect will be quite easy to cover, because you get access to all the procedures, how they carry out and everything. You get exposure to that. So definitely that is going to be helpful. But if you want to practice in UK, clinical dentistry in UK, you have to clear the license exam. That is the ORE exam which you have. But this course is definitely recognized worldwide. If you tell anyone about the Masters in Aesthetic Dentistry from here, most of the people will know about this.
Sure, of course. It's very few people get admitted to this course, and I'm sure it's a vigorous course. One last thing, I always ask, my colleagues and my students that suppose today you go back to your undergraduation and given a chance to do it again, because sometimes you may not realize that you had this opportunity, but you did not do it. When people were allowing you to do it, but as a student, sometimes you don't realize that is important. What will you change in your days of learning in India, maybe whenever you were a student?
So I think I would like to do more of the restorative procedures than I did. I think I just observed them, but because I remember in internship, some of the students, when they asked if I could do this procedure, especially in the perio classes or even during oral surgery, I remember they had this course for implants. I wish I did those courses. Because that would have definitely given me a more head start to the practice which I started later on. So we had access to those things, but I think we take them for granted during undergrad, which we should definitely explore and try and take advantage of during our UG days.
Thank you so much, Dr. Arjita, for your time and wonderful explanation about this degree of Masters of Aesthetics from King's Dental College, Dental Institute School, UK. I thank you for coming on Aspire 32 and giving me your precious time for explaining about this.
Thank you so much for having me. Thank you.
Thank you.
Thank you so much for having me.
My dear viewers, if you like this podcast, do mention on the comment section and click the like button and share with your friends. Bye for now.